Thank you for opening the video. Smile Trouble Consultation Room. Do you have any symptoms of dizziness? Is that dizziness a spinning dizziness? Or is it just fluffy dizziness? There are various diagnoses for dizziness given by medical institutions. There are also diagnoses of dizziness whose causes are not yet known. If you take the prescribed medicine, but it only works for a short time, and the symptoms reappear over time, symptomatic treatment is recommended. It is necessary to properly identify the cause and provide appropriate treatment for that area. This video provides detailed information including the causes of dizziness, so please watch until the end. Dizziness can be defined as vertigo, which includes spinning dizziness, floating dizziness that makes you feel like you're walking on a cloud, dizziness that causes agitation, and lightheadedness on standing up. Benign paroxysmal positional vertigo is the most common type of vertigo caused by the ear. Conditions that cause dizziness include benign paroxysmal positional vertigo, which occurs when you change the position of your head, such as when you wake up or turn over. I often experience vertigo, spinning around in circles, which subsides after a while. It may also cause nausea. There is a semicircular canal at the back of the ear. The semicircular canals are filled with endolymph fluid, and by changing the flow of endolymph fluid when you move your head, you can gain a sense of balance in your body, such as forward and backward, left and right, and up and down. However, dizziness occurs when otoliths, small particles of calcium in the vestibule of the inner ear, become dislodged and move inside the semicircular canals. The otoliths then float or adhere to the semicircular canals, and moving the head adds abnormal stimulation, causing nystagmus, which causes dizziness. Otoliths become more likely to fall off as we age, so benign paroxysmal positional vertigo is said to be more common in women in their 60s and 70s. If benign paroxysmal positional vertigo is suspected, an otorhinolaryngologist will perform a nystagmus test in addition to a general ear examination. What is a nystagmus test? Nystagmus is the movement of the eyes like a pendulum when the head moves, but when dizziness occurs, it becomes impossible to control the nystagmus. We will examine certain inner ear conditions. As the disease name states, benign paroxysmal positional vertigo is benign, and most cases seem to get better within a few days to 2 weeks. However, rather than making a diagnosis on your own, consult an otorhinolaryngologist as soon as possible. Also, if you have symptoms such as dizziness, but also difficulty speaking, not having strength in your hands, or not being able to swallow food down your throat, you may be suffering from a stroke, so immediately call an ambulance. Please call and see a neurosurgeon. In benign paroxysmal positional vertigo, by moving your head several times in the direction of the dizziness, the position of the otoliths changes and the dizziness may subside, or you may turn over to the side that causes the dizziness. It seems to be effective. If benign paroxysmal positional vertigo is diagnosed, a treatment called floating otolith replacement is performed, which involves moving the patient's head and body to move the otoliths that have entered the semicircular canals. Meniere's disease is caused by a buildup of endolymph fluid in the inner ear, which controls the body's sense of balance, causing dizziness. Vertigo is a type of vertigo that spins around in circles, causing a sensation of stuffy ears, hearing loss, ringing in the ears, and nausea. Even if the symptoms subside, they tend to recur, and people who had difficulty hearing only low-pitched sounds may now find it difficult to hear high-pitched sounds as well. In addition, since Meniere's disease tends to recur repeatedly when stressed or tired, it is thought that an imbalance in the autonomic nervous system may have something to do with it. A hearing test is performed to check the way you hear sounds to check for hearing loss, a nystagmus test is performed using special test glasses to check for nystagmus, and a diuretic called glycerol is taken, which is said to promote lymph drainage. Then, a test called a glycerol test is performed to check the difference in hearing before and after taking the drug, and imaging tests such as head CT and head MRI are performed to differentiate it from other diseases. Treatment for Meniere's disease includes drug therapy that uses drugs to suppress vertigo attacks and drugs to improve endolymphatic hydrops, and intratympanic injection therapy, which involves making a hole in the eardrum and injecting the drug directly into the eardrum. If symptoms do not improve with drug therapy or intratympanic injection, surgery may be performed. Anti-vertigo drugs such as sodium bicarbonate and autonomic nerve modulators are also used to suppress dizziness. Diuretics and steroids are used to improve endolymphatic hydrops. Injection therapy uses a type of antibiotic, such as gentamicin. Then, there is the endolymphatic sac release surgery, which opens the endolymphatic sac and restores the normal flow of lymph in the inner ear. There is also vestibular neurectomy, which involves cutting the nerve that controls the sense of balance. The mechanism by which endolymphatic hydrops occurs has not yet been elucidated. Possible causes include fatigue, stress, lack of sleep, allergies, immune disorders, and insufficient blood flow to the inner ear. You need to improve your lifestyle to prevent it. Vestibular neuritis is a disease in which the vestibular nerves become inflamed due to a viral infection such as a cold, causing dizziness, nausea, and vomiting. However, the detailed causes of inflammation in the vestibular nerve are still not completely clear. In order to differentiate it from Menieresdisease, etc., it is important to check whether there is hearing loss or tinnitus. Since the cochlear nerve is normal, there are no symptoms such as hearing loss or tinnitus. Tests include nystagmus testing, audiometry testing, temperature stimulation testing, and vestibular evoked myoelectric potential testing. These tests will diagnose whether inflammation has developed in the vestibular nerve and its function has declined. As for treatment, vestibular neuritis is said to recover in about 1 to 3 weeks if you rest. However, if the symptoms of vertigo are severe and the patient suffers from nausea and vomiting, anti-vertigo drugs, intravenous fluids, or anti-nausea medications may be administered. Depending on the symptoms, steroid hormones may be administered. The ear is broadly divided into the outer ear, middle ear, and inner ear, starting from the outside. The inner ear is a small organ about the size of a 1-yen dime. Sound detection occurs in a part of the inner ear called the cochlea. In addition, the semicircular canals sense rotation, and the otolith organs sense gravity and linear acceleration to maintain body balance. The inner ear has 2 functions, a sound sensor and a sense of balance. When the inner ear becomes inflamed, these 2 sensors stop working properly. Auditory symptoms such as hearing loss, a feeling of fullness in the ears, and tinnitus due to otitis media may also appear, as well as symptoms such as dizziness and balance disorder. Inner ear inflammation is mainly caused by bacterial or viral infections. It can also be caused by gradual spread to the inner ear via the middle ear, so consult a medical institution at the stage of inflammation of the middle ear and take early prevention and treatment before it becomes an inner ear infection and the treatment is prolonged. Is important. Treatment generally involves drug therapy using steroids, etc. Sudden hearing loss is sudden onset of strong tinnitus and hearing loss in one ear. It may also be accompanied by dizziness that makes you spin around. It is a disorder of the inner ear, but the exact cause is not yet known. It also seems to be characterized by the fact that the seizures do not recur. It is said that stress, overwork, lack of sleep, etc. can easily cause this condition. Treatment is mainly drug therapy with corticosteroids taken orally or intravenously. If symptoms appear, seek medical attention as soon as possible. Orthostatic control disorder is a symptom that occurs frequently in people around puberty and is caused by an imbalance in the autonomic nervous system that causes dizziness, palpitations, and fainting when standing up. Orthostatic hypotension also refers to a drop in blood pressure that occurs when you suddenly stand up or sit up, causing lightheadedness. It occurs when blood circulation to the brain decreases, causing dizziness, nausea, and possible fainting. If you experience these symptoms, you may have orthostatic control disorder or orthostatic hypotension. Symptoms include headache, abdominal pain, palpitations, lightheadedness, fainting, general malaise, inability to wake up in the morning, feeling unwell in the morning but feeling better in the afternoon, loss of appetite, motion sickness, and looking pale. Orthostatic dysregulation and orthostatic hypotension are symptoms that occur due to a decline in autonomic nervous function, resulting in disturbances in circulatory regulation such as decreased blood flow to the upper body and brain, which can interfere with daily life and social life. It may happen. Treatments for orthostatic dysregulation and orthostatic hypotension include drug therapy and non-drug therapy. Medication therapy involves prescribing drugs that act on blood vessels to prevent blood pressure from dropping and ensure blood flow to the upper body and brain. Non-drug treatments include exercise therapy and fluid intake, but avoidance of stress is important. Try to lead a regular lifestyle and drink enough water and salt to increase circulating blood volume. In order to increase the amount of blood returning to the heart, it is thought to be effective to increase the muscle mass of the lower body through exercise and increase the function of the muscle pump. It is also important to remember to stand up slowly and not suddenly. Even when using drug therapy, it is important to use these non-drug treatments. I often hear about endolymph fluid being the cause of dizziness, but I think we need to think about it. The symptoms are caused by the accumulation of endolymph fluid, so it is important to focus on the production and absorption of endolymph fluid. Endolymph is produced in the cochlear stria vascularis and vestibular dark cells, and endolymph is absorbed into the endolymph sac epithelium. These tissues are also involved in the autonomic nervous system. This shows that the imbalance of the autonomic nervous system, which is said to be the cause of fluffy dizziness, is also deeply related to dizziness. The balance of the autonomic nervous system is disrupted, and endolymph fluid in the semicircular canals is produced more than necessary, and absorption is inhibited more than necessary, resulting in an increase in endolymph fluid and swelling. You also need to consider that the balance of the autonomic nervous system is controlled by the hypothalamus and the brainstem. Certain causes affect the function of the hypothalamus. One cause is cervical vertebrae distortion. If there is pressure on the nerves at the location of cervical vertebrae distortion, it will affect the outside of the body, resulting in stiff necks and shoulders, and at the same time, it will affect the function of the hypothalamus and the brainstem. This means that the cervical vertebrae are distorted, disrupting the production and absorption of endolymph fluid in the semicircular canals, and when endolymph fluid increases, symptoms of dizziness appear. Also, the brainstem and cerebellum are deeply involved in balance function. The semicircular canals are filled with endolymph fluid, and information about the body's position is determined by the flow of endolymph fluid that matches the body's movements. The nerves in the semicircular canals detect which direction the body is moving, and this information is transmitted to the brain via the nerves. In addition, positional information from vision and sensations felt by muscles and joints are also transmitted to the brain via nerves. The brain integrates this information and instructs the body to take the most appropriate movements and postures. Due to an imbalance in the autonomic nervous system, endolymph fluid in the semicircular canals is produced more than necessary, or its absorption is inhibited more than necessary, resulting in an increase in endolymph fluid even though the body is not moving. The endolymph fluid moves, and the patient mistakenly thinks that the body is moving, causing symptoms of dizziness. The balance of the autonomic nervous system is controlled by the hypothalamus and the brainstem. However, when there is a misalignment of the cervical vertebrae, the function of the hypothalamus is affected. This means that when the cervical vertebrae are distorted, the production and absorption of endolymph fluid is disrupted, and when endolymph fluid increases, symptoms of dizziness appear. Also, fluffy dizziness is also related to cervical vertebrae distortion. Even if it is determined that the cause is cervical spine distortion, it will not be effective unless the correct treatment is performed. If you would like to learn more about dizziness or find out information about the correct treatment to improve cervical spine distortion, please click on the URL of the Smile Trouble Consultation Room homepage in the Overview section. There is no consultation fee. We look forward to your call. Get the right treatment as soon as possible and get your body back to its original health. Thank you for watching the video.